Welcome to the Johns Hopkins Kimmel Cancer Center's Fine Print of Cancer series. I'm Terry Langbaum, Chief Administrative Officer of the Cancer Center. Our experts at the Harry J. Duffy Family Patient and Family Services Program are here to take you through the parts of this disease that have nothing to do with treatment but have everything to do with survival. The Fine Print of Cancer will help you to understand the importance of advance directives and filing for Social Security disability. We'll talk about the role of the caregiver. In these segments, we'll also talk about the mixed emotions of cancer, spiritual and pastoral care, and when cancer hurts the most, how our patient and family services offer a steady hand to help you make decisions about hospice care. This series will help you through the fine print of cancer.
Cancer's physical side effects can be brutal. Chemotherapy can cause hair loss, nausea, and rashes. Radiation can burn the skin and bring on debilitating fatigue. But what about the emotional side of the disease? Hearing the words, "you have cancer," creates a flurry of emotions: panic, fear, anger, or anxiety. I'm Liz Carino-Tomasi, and I'm here to discuss the mixed emotions of cancer. There is no more challenging world to live in than Cancer World. So how do you cope with it all? Coping is something we do in everyday life. But when cancer enters the picture, coping becomes the way we manage difficult, stressful circumstances. How do you cope in Cancer World? A good choice for some is to seek support from others. Talk with family or friends, attend a support group, or talk with other patients. Rely on your faith or spiritual beliefs for strength. Others cope by educating themselves about their disease, reading everything about the illness, scanning the internet, and attending lectures and conferences. Or seeking professional help, meeting with a social worker or another mental health counselor, or visiting with a chaplain or your own spiritual leader. Just remember, intense feelings come with cancer diagnosis, so don't be afraid to ask for help. We've all felt sadness from time to time. These feelings usually pass within a few days. But if they linger or begin to interfere with your life, you may be suffering from depression. A diagnosis of cancer can add to this equation. It's important to tell your oncologist how you're feeling. There are ways to treat depression. Anxiety is another emotion that comes with living with cancer. Worry or fear about an upcoming scan or treatment is considered normal anxiety. But if you're worrying to the point that you can't sleep or you're having trouble getting through the day, you may need help from your care team. Even those who have the best ways of coping may find they need extra help sometimes. Make no mistake, the cancer journey will challenge you in many ways. It will require you to call on inner strengths that you may not know you have, just to deal with these mixed emotions. How you reconstruct your initial emotional response, the worry, fear, anxiety, even despair, will establish the way you learn to cope with your cancer journey.